All right, everyone. In this podcast, I have YouTube legend Evan Lavizadeh, who famously had a double jaw surgery with Dr. Walin about 3 or 4 years ago, got a 2 centimeter advancement on the mandible, completely transformed his airway health, completely transformed his aesthetics. He's cured of his sleep apnea, AHI approaching 0. He moved on with his life, and that's why he stopped posting to YouTube. Airway health, jaw surgery was just a means to an end for him. It was not an all-consuming thing that he fixated on. He really just wanted to get better, and he did. And that's why we haven't heard from him. Well, we're going to hear from him in this podcast. He's going to give us his life update. What's it been like the last couple of years now that his health is great and his looks are much improved? How has his work life changed, his finances, his dating life? Does he tell partners that he has had this procedure? Has he deleted his old images off of social media? How has this impacted his relationship with family, with friends, with his spirituality? We're going to get into all of that. And of course, if you want to have a chance to ask Evan your own questions, he is going to be coming into the Joint, which is my membership coaching space where many of the guests that I interview on my podcast come in and take live questions from members of the Joint. So if you want to have a chance to speak to Evan one-on-one, you can do so inside the Joint, link in the description below. Otherwise, enjoy our conversation now. Evan Lavizadeh, thank you so much for joining me today. I've always wanted to meet you. This is the first time Evan and I are actually meeting. Evan ran an incredible, insightful YouTube channel that was part of the jaw hacking space up till a couple of years ago when he went through a MARPE procedure and then a double jaw surgery. So, Evan, I just want to come right out and ask you to get us up to speed on the facts. When did you have your MARPE? When did you have your jaw surgery? And why did you stop YouTubing? Is it because you were, and then just give us the short version. Were you cured? Were you botched? Or was it somewhere in between? It's complicated and you just didn't want to talk about it anymore?
Those are great questions. Yeah, thanks for having me, Ron. I was diagnosed with sleep apnea in 2019. I'm sure I've had it my whole life. I got the MARPE I was diagnosed in early 2018, actually. And then about 2 or 3 years later, I got the MARPE in 2020. And almost a year after that, about 8, 9 months after that, I got jaw surgery in 2021, at the end of 2021. So about, 3 years of being diagnosed with no treatment. And then I got to the MARPE and double jaw surgery process, which was about a year from start to finish. I had some other like soft tissue surgeries in between them that did nothing. The YouTube question is good. So I am cured. I got a follow-up sleep study. My results are fantastic. I feel very, very lucky. My life is a lot better. I don't have a good explanation for why I don't make YouTube videos anymore. I think that like making YouTube videos was a way to like give purpose to my pain. Like I was going through all of this like sleep deprivation and depression and uncertainty, but it was at least in an effort to help others. Now that I'm on the other side of it, I feel like I wanted to kind of return to like focusing on living a normal life. Like I can work again, I can go skateboarding again. I can socialize again. Sometimes I do feel a little like, oh man, like I was helping people and now I'm not. And so I am intending to get back into it. I have been saying that for like 2 years, but I still do believe that I'm going to get back into it. I just don't know exactly when or what it's going to look like.
Would it not necessarily be in the airway health space?
It certainly would be. Yeah. Yeah, I think so. There's a few things I want to sort of like share that I think for example, I want to share like a little bit of details about how my jaw surgery went and maybe make some diagrams and talk about how there were certain trade-offs that I had to consider that I talked about with my surgeon. Like these little things I really want people to know when they talk with their surgeon. Those types of videos are just more effort, because I got to get like diagrams out and I don't know, like maybe make a slide deck or something. And so I have to kind of sit down and like go back and get all my old scans and prepare material. It's a lot of work. It's fun work, but it's probably going to be airway related. Yeah.
Yeah, I know how much work that is, and that's why I don't do a lot of videos like that. I tend to do the lazy videos where you just turn the camera on and start talking shit.
Yeah.
It's
fun. I mean,
yeah, the vlog style. But just so you know, I mean, you currently have more subscribers than most other people trying to break into the airway health space right now. So if you were to jump back in, you're off to a hell of a start.
yeah, I think you're right. And you never know where it can go from there. Like I want to continue interviewing doctors and stuff. I just love hearing from them. I think like I've started to find ways to live a more like balanced life where I'm not just all focusing on work or one thing or another. So I'm pretty hopeful that within the next month or two, like I'll have another video up probably.
Oh, that's incredible. Perhaps you could use the launch of this podcast, and if when that video comes out, we'll be sure to pin a comment and attach it to this video so that maybe we
Sweet.
can get a little audience transfer going. And I think the world will be pleasantly surprised to hear that Evan is back.
Awesome. Thanks.
Yeah.
Yeah, I think it'll be motivating. Yeah.
I'm definitely cheering on creators in this space because I have a rising tide theory where the more creators that are making content in the airway health, jaw hacking space, the more public awareness, and then the more all channels benefit. So,
Absolutely.
yeah. So that's good. So, can I ask you who your surgeon was? Are you okay sharing
yeah.
that?
Yeah, cool. Yeah, absolutely. I got a lot of different consultations, but my main team was my MARPE was with Dr. Audrey Yun here in LA, and my jaw surgeon was I guess maxillofacial surgeon was Dr. Benjamin Walin, also here in LA. He works in a group called LA COMS, LA Center for Oromaxillofacial Surgery.
Mm.
And they were fantastic. I think Audrey felt easy to choose, but choosing a surgeon was like such a anxiety-inducing process.
How did you settle on Dr. Walin? Of course, I'm well aware of him, as is probably many people watching right now. He's famously one of the few people that hasn't been subject to the Reddit lynch mob of surgeons. He has a pretty clean reputation online.
Yeah.
If I do hear complaints about him, it tends to be that people were talked out of MARPE and then they leave surgery with Walline still desiring some sort of nasal breathing improvement.
Yeah.
If other criticisms of him could be leveled, it would be that he were, conservative. But you look like you've had some pretty aggressive movements. Could you just tell us what your movements were, if you remember?
Yeah, I remember my pogonion. I don't know how to pronounce that since I feel like I only ever read it pogonion or pogonion.
Or just pog.
Pog, yeah.
Yeah. The tip of there's the skeletal pogonion, and then there's the soft tissue pogonion. So basically the tip of your chin in the forward direction.
Yeah. That moved 20 millimeters.
Wow.
And I think I had like 7 or 8 degrees of counterclockwise rotation. It's counterclockwise, right? Yeah. And they did like he did a halfway combo between impaction and downgrafting. So there was a tiny bit of impaction and like there was a tiny bit of downgrafting. So it was some kind of like combo hybrid solution, like moved a little bit with impaction and then moved a little bit in the other direction with downgrafting.
Right. Was it like the front was impacted a little bit as it was rotated, but the back was downgrafted?
Yeah. So that's exactly right. Like the difference between the two can be characterized in where the fulcrum point is. So impaction has the It has the fulcrum point at the back, and downgrafting has the fulcrum point at the front. I may be wrong about this, but that's how I kind of characterize it in my head. So he rotated a little bit down this way, or a little bit up this way with impaction, and then a little bit down this way with downgrafting. Is that true?
Yeah, well, I mean,
May not be.
with a rotation, right? You're basically getting, so if you
Yes.
have underdeveloped jaws, your bite plane tends to be, you know, on a descending slope toward the earth, right? Like
Hmm.
this. And
Yep.
then with a rotation, you're getting a little bit of this,
Yep.
right? So the back comes down, and then the front can come up and impact a little bit potentially,
Hmm.
and which is, the reason that counterclockwise rotation is relatively new, I guess you could say, or relatively rare, is because of that big gap that's created at the back of the maxilla, where the downgraft occurs, because historically there has been concern that there would be non-union there because of how big the gap was between the part that's cut off, like the free-floating denture maxilla, and then the rest of the cranium that remains fixed. But Dr. Wolford kind of pioneered the counterclockwise movement. And yeah, so much for Dr. Walline being ultra-conservative. It sounds like you got a counterclockwise rotation, a downgraft, and a pretty significant movement on, at least on the mandible, and then a large rotation. Did you say 8 degrees?
Yeah, I think it was something like that, between 6 and 8. I know it was like between 5 and 10. It's been a few years. I didn't know that history. That was really interesting. But yeah, let me quickly comment on that. So my experience is also that Walin is conservative. His first um, virtual surgical planning that he did for me had the POG only forward about 15 or 16 millimeters. And meanwhile, I had another surgeon in Sacramento who had planned 28. There's such a massive, massive difference. And one of the things that, and there were other things as well, but one of the things that made me feel better about moving forward with Dr. Walline is that I just told him, I was like, hey, I'm a little bit worried about this not curing my sleep apnea. 15 to 16 seems like a little bit conservative. This guy said 28. And Dr. Walline said, 28 is ridiculous. Like, you're going to have a really high likelihood of complications. But yeah, my plan is conservative. If you're willing to like take on extra risk and like jaw pain and or jaw joint pain and so on and so forth, he was like, I will make it. I will advance you more. It's just about you incurring an extra risk. I think like the truth is that there is sort of a scale that you can slide between how much advancement and how much risk. And a good surgeon, I think, will be willing to just kind of more or less do what you want as long as it's within a reasonable bound. And so he was like, cool, yeah, like I'll just give you another plan by tomorrow. And so he
Mm-hmm.
did. And I was like, okay, yeah, this looks great. And so just the fact that he was able to like take my feedback gave me a lot of faith in him. So, but I think you're right. I think most people's experiences, he's very conservative. He is not a sleep guy. He's not a sleep apnea guy. Like he, I think, got his success, or most of his career was like just doing surgeries for people in Hollywood who wanted some aesthetic benefits, specifically like in summers, like before, like during summer break for like teen actors. I know he was a big part of his clientele. So, and they're very risk averse. And so I don't think he thinks very much about the airway benefits. But if I was just able to talk to him and he did, so it was cool.
Yeah. Did you have a genioplasty as part of that 2 centimeter movement?
Yes.
So we're comparing apples to apples. When you said 2 centimeters versus 2.8 centimeters with the other surgeon.
Oh, sorry. It was 15 versus, oh yeah, you said centimeters. That's correct. So it was 15, I think, if I remember 15 millimeters versus 28. And then Walline met me in the middle at 20.
Right. And both of those plans included BSSO and Genio.
Yes.
It's not that Dr. Walline's plan didn't have a Genio and it was, just 15 millimeters pure sagittal split. It was so the other guy was a whole centimeter more aggressive. And was
Yeah.
that must have been Stanley Liu, because Audrey Yun, surgeon in Sacramento.
That's a very good guess. Stanley Liu was the third surgeon I had considered. The guy who gave 28 was in Sacramento. Stanley Liu was in Stanford, which is like San Jose, which is but maybe about like hour and a half from each other.
Mm.
Maybe I'll like post it in a comment. I can't remember the guy in Sacramento. He's like a Russian surgeon. But I did also consult with Stanley Liu, and I had this like deadline where I had to confirm my surgery date with Stanley Liu, and I waited up until like the day of the deadline, and that's when I picked Walline. I was very close to picking Liu.
Yeah. Your the change that you had Dr. Walin make, was that based on a 3D final plan that he gave you like in the few weeks or the week before surgery, or was that based on the pre-plan that he gave you at the initial appointment?
Oh, that's a good question. I don't know the difference because all the material that I've ever got from him have all been these like 2D side view plans. So I don't think I've ever seen the 3D plan. Maybe he had one.
Yeah. Yeah. The reason I ask is because there's a lot of discussion now about sort of the timing of how surgeons present plans to patients, where there's this thing that happens where you have your initial appointment and you get this so-called 2D pre-plan, which is, you know, that two-dimensional sketch where you have the before tracing and then the after tracing in red, and it shows the delta with the numbers that show the movements, and that's all great. But then you go through a year or 18 months of orthodontics, and then you come back and they create a whole new plan, which is the final plan that is actually used to create the splint, which fixes the surgery, or the custom plates, which again fixes the surgery. And the problem is that 3D final plan, it's more labor intensive, right? Because the pre-plan is just, you mark some landmarks on the software and then you put it into an algorithm, and the algorithm gives you a suggestion of roughly what the movements are going to be. But the 3D plan is surgeon, engineer at the splint making company or the custom plate making company actually sitting down and collaborating, and the surgeon incurs a fee from the manufacturer for that process, and then things are ordered. And so essentially what that means is you can't turn back from that if the splint or the plates are ordered, because they're several $1,000s. Then the patient gets presented with the final plan, and if the patient doesn't like it, well, sorry, it's already been ordered. We have to charge you an extra couple $1,000s, or we have to reschedule the surgery because the new ones aren't going to make it in time. And then there's this sense of the patient being coerced into whatever plan the surgeon had come up with the engineer, with the patient somewhat left out of the loop, right? So I guess what my question for you was did all of this happen just a week or two before surgery, or did this happen months before surgery that decision was made about the bigger movement?
That's a good question. I didn't know any of that. That is really fascinating. I can really see how that leads to a coercion. I think there's that when you're getting closer and closer to surgery, it's like there's a feeling of wanting to get it over with. I think it's very easy to make mistakes. I think I almost have made mistakes in my journey. To answer your question, it felt like pretty close. I think it was like maybe a few months or 2 months or a month before surgery. It was pretty late, because I remember when he gave me the new plan, I was like pretty sold after that. I don't remember having to wait too long.
Yeah,
But have those discussions early.
for sure. How did you decide on Dr. Walin ultimately? And was it only those 3 total surgeons that you had consulted with, or were there others?
There were others that I had like initial consults with. Those were the only 3 that I were actively considering. Honestly, yeah. So there was this Sacramento surgeon who, what was attractive about him was like he gave me this like super large advancement and told me it was going to look great and my sleep apnea would be cured. So that's pretty entrancing. Then there was Stanley Liu, who was, a reputable guy, and he was in network, so it would have been covered by insurance, so I wouldn't have to pay a dime. That's pretty enticing. And then there was Walin, who was expensive and conservative, didn't have any of those benefits, but My orthodontist, Dr. Audrey Yun, preferred him, which I think says a lot considering that Stanley Liu is her co-surgeon. And when I met Stanley Liu, I wasn't super crazy about him. He kind of got a little bit. It was minor, but I pick up on these things. I'm sensitive to these things. He got a little testy with me, and so I just got a little bit rubbed the wrong way, and he ended up kind of like I think making a mistake. He wanted to give me his what do they call it? Is a dome, their maxillary expansion surgery. It's like their version of SARPE, and I didn't end up needing it because Dr. Audrey Yoon gave me like a custom expander that was stronger than your typical like off-the-shelf MSE, and he didn't like that. And he couldn't really admit his mistake because Dr. Audrey Yoon was right, and I expanded, and it was amazing, and I didn't need surgery. And I just got a little bit of a weird vibe. And so, and I really, really, really think highly of Dr. Audrey Yoon. I really respect her as a person and as a medical professional, just incredible person. Like, it was hard for me to decide my surgeon. It was not hard for me to decide my orthodontist. So, like, I really felt like I was comfortable, like, leaving my case in her hands. And so, if she had a vibe, like, that meant a lot to me. So I was like, all right, we're going with Walline.
Yeah, so then you basically just followed Dr. Yoon's lead when it came to Dr. Walin, and for sure the orthodontist-surgeon relationship is very important. Do you have any insight as to what type of communications they had with each other, or any distinct memories of having to struggle to get them to talk, or was it all just smooth and it all just happened in the background?
It was all smooth and happened in the background. I think Dr. Yun said there was a chance she would be there in the operating room, but she wasn't. I think that they both have like very chill personalities. So if anything, I wouldn't be surprised if they kind of under communicated. But I don't have a lot of insight into like their relationship. I've never seen them interact.
Yeah, yeah. Do you know, I meant to ask you this earlier. This is the first I'm hearing that Dr. Walin had a history of operating on celebrities, like in the cosmetic enhancement, from a cosmetic enhancement angle. Do you know who some of those celebrities were? Are there any like big names?
I have no idea. It's something that he said, and when you visit their office, it kind of fits the vibe when you consider the location.
Basically,
And
right next door to, it's near Hollywood, right?
yeah,
It's in Santa
exactly.
Monica.
It's in Century City, which is actually closer to Hollywood than Santa Monica. It's kind of halfway between. So yeah,
Yeah, yeah, that's right. That's right. What was Dr. Walin's attitude toward your MARPE with Dr. Yoon? Did he see that after it was already done, so he didn't really have to deal with it? Did he try to talk you out of it? I know he's not very bullish on MARPE.
yeah. He tried to talk me out of it lightly. I mean, I wouldn't say he tried to talk me out of it, but yeah, you're correct. He was super neutral, and he just like felt like, like I don't like, I don't really care for MARPE. He was like, if you pay me a few grand, I'll install it for you. But the rest is up to you. I'm not gonna like manage your case. He was like, I don't know. I just tell my patients to do a three-piece Lafort, which is like, MARPE is expanding slowly with a device, and three-piece Lafort is like, let's cut it into pieces, spread it out, and bolt it all back together, which has implications into how much breathing benefits you get out of it. It's certainly less. So that was the weird thing about Dr. Walin that made me hesitate, is because he just didn't, he kind of seemed to like, he almost seemed to get bored when he considered breathing effects. It's just, I don't think he cares. It's not his thing. And that is a little weird for me.
It is weird. The only way to come to terms with that is like that a rose by any other name smells as sweet, right? Like an advancement is an advancement and is going to have the same airway volume effect no matter what reason it's done for.
Yeah.
But you're not the first person to tell me that it was concerning how apathetic that Dr. Walline is toward airway stuff.
That's exactly right. And even little things, I was like, oh, like, are you going to do a nasal floor recontouring? He's like, yeah, I always do it. And I was like, do you think you can like do it a little more? And he was like, yeah, it'll incur a little risk. I'll try not to hit the roots, but sure. So it's like Dr. Walling is perfect if you know what you want. If you don't know what you want, he's not somebody that you can just like leave your case in his hand. Well, if you're a sleep apnea case.
Yeah. So when you say know what you want, help me understand. First of all, are you happy with your surgery? Do you think it came out just the way you envisioned it?
Yeah, my sense, and on that, I'll never know, but my sense is that my results were optimal. I definitely have a better outcome than like, I don't know, like almost anyone I talk to. And I don't think that's on me. I think a lot of my online friends at that time like gave me really good advice, and I was very blessed to just like have the support of so many people. But my sleep apnea is 100% cured. Like I have like no complications. I have like some jaw pressure, but that's just par for the course. No numbness. Um, I'm happy with my aesthetics. I just can't really imagine it being any better. So, and it's not a very safe. It's not the safest surgery, right? It's very difficult, very complicated, and you really don't want to do it more than once. So, I think I'm as happy as I could be. Very lucky.
Yeah, that's incredible. Can we see what it looks like on a swivel? Can you kind of give us one of these?
Yeah. Yep.
Oh, damn, bro. Your side profile is killer.
It was so bad before too. It was just like almost just like, I don't know, like the characters on Bob's Burgers.
Yeah. Is it cool if we edit in a before photo?
Mhm. Yeah, absolutely. I have some I'll send you.
Can we see the other side too, and like in the dynamic? Like, yeah, just kind of do your thing.
Yeah, sure.
Can you
How about
are you able to lift the camera up to level with your face at all?
Yeah. Mhm. So how's this?
Yeah, that's
Just
good.
guide me.
Yeah, just rotate back toward us. Yeah, man, you look like a man.
Thank you. I used to be very insecure about my jaw profile and then like my disproportionately big nose, but it feels much more like things come together, and I feel much more confident in my looks for sure.
Is pretty privilege real?
You know, it feels real. Like I do, but sometimes I wonder if it's just my own, like my own insecurities kind of alleviating and then confidence comes out. But I, I do sort of feel better about like the way that I move through the world, with platonic and romantic relationships. So I feel like, yeah. I mean, at least relative to what I was before. But again, that might just be, what also makes it hard? Having sleep apnea, my just eyes are drained and my face is puffy and I'm like kind of like like anxious and not really able to like maintain conversations. It's not a good look. So much has changed, but I mean, yeah.
Yeah, it's the eyes are the window to the soul theory, where the eyes reflect disease and mental disorder, and when you start getting better sleep, your eyes get whiter, the area around your eyes starts to shine more, and it's a real glow up. And
Yeah.
that actually matters for aesthetics. Because when
100%.
you meet someone, where do you look? You don't really look anywhere except the eyes. Like you meet someone and you lock into their eyes. And I just remember there's this scene from Romeo and Juliet with Leonardo DiCaprio, and I think it's Claire Danes, and it was 1996 this movie came out, and it's set in a modern setting, so it's like Romeo and Juliet 20th century, and the scene where they meet, one of them is on one side of this fish tank at this party, and then Leo comes up on the other side, and then their eyes lock through the fish tank, and the scene literally gives me chills.
Oh, I gotta watch that.
You got to. It really demonstrates the power of eye contact and how much attraction can occur through the eyes and through eye contact. So yeah, it's interesting that you mentioned that.
I believe that entirely.
Yeah, yeah. And can you think of specific moments that you've had over the past 3 or 4 years where you were like, oh, yeah, I'm a Chad now? Of course, that's the way it went.
Yeah, I think the easy answer is just like I showing people who didn't know me. Well, I mean, even if the people did know me before, seeing the before and after, if they're a new person in my life, or just seeing me now, if they have known me before. I mean, people give me feedback like, "Oh my gosh, like, I mean, I don't mean to be offensive, but you look a lot better now," and so that always felt very good to hear. In terms of like anything worth subtle, I think it's hard to point to. Um, but yeah, it's I feel like when I was really struggling with sleep apnea, I just felt like my social life was awful. I think there was more to it. I think I also was kind of very a more self-pitying person, and like cynical and depressed. And I just don't think people were like as excited to be in my presence. Um, Not saying that people are super excited to be in my presence anymore, but I just feel like my ability to connect is so much better. And I do believe part of that is aesthetic, and part of it is, sleep apnea interferes mostly disproportionately with REM sleep instead of non-REM sleep. And REM sleep is responsible for social intelligence and creativity and the ability to connect with others. Um, so yeah, I feel like, yeah, my social life is just like dramatically better.
Do you did you purge all old pre-photos of yourself from your socials and from your life, or
Um, there's a that thought crosses my mind, but I grew up very, very insecure about my looks, about my masculinity. I had phases of my life where I overcompensated. I'm not proud to say I had a phase of my life where I was reading the red pill. And I think like there was a slow progression where I decided I sort of healed from a lot of that stuff. And part of that is not being embarrassed. I think that, you know, if it helps someone else to see, then I want people to see it. And I also want to say that I accepted myself before and after. And I don't feel like I can really honestly say that if I'm kind of like deleting old pictures of myself. So no, I mean, even when it would feel a I would get a little nervous at times, but like if even on like a second date or whatever, if the subject came up with jaw surgery, like I wouldn't hesitate to show them my before and after, or even my day two after jaw surgery, where my face is swollen up, and
wow.
I am insecure about my looks. I mean, mostly before therapy and stuff like that, just because I was a very insecure kid. But I almost feel like it's medicine to try to do those things that, reduce, take away from that image that we all try to portray in the world of who we want to be.
Yeah.
Um, yeah.
Yeah. To go back and try to delete images is just perpetuating the insecurity.
Yeah. You said what I was much more succinctly what I was trying to say in many words. That's right.
Yeah, and personally for me, when I see someone who has a jaw surgery transformation, I'm often very attracted to it, right? Like if there's a woman who has this incredible transformation, I'm not like, yeah, like objectively she looks good. However, I'm turned off by the fact that this is artificial, or
Right.
it's just an animal instinct, like, yep, wood, and
Yeah.
and with it's in some ways it's even to me, I guess, because I'm so deep in this space and I understand what goes into these transformations. I find it very intriguing, and so it's probably it's probably the case that it's not actually a turnoff when people see the befores and afters. In some ways, it might even be a turn on in some weird way. I mean, human attraction is this weird, non-linear thing, you know?
Yeah, you're so right. I have gotten feedback about like you did that. That was cool. Like that's scary, and you put the work in. And I think that I certainly the same. Like if I am, considering, on a date or whatever, and I hear the struggles that someone went through and overcame on their own, like that's hot.
Yep. Another thing is everyone deals with their own insecurities and with their own health problems. So many people have chronic health problems these days that it's very relatable for someone to have gone through a disease period and then use their intelligence and their perseverance to figure it out and solve it. There's a lot to talk about there.
Mm-hmm. Yeah. Yeah, I love hearing those stories.
Yeah, for sure. So, what about your MARPE? How did that go? Was it symmetric? How big was it? And what effect did that have on you? And like, why did you still have to do a jaw surgery after?
Great question. I had both recession and this direction. I've since forgotten the names of the directions, but I both had recession here and a narrowness this way of my maxilla. And the narrowness of my maxilla causes nasal congestion. And so I knew from the start that I would have to do both. And one or the other would lead to improvements, and I'd be a little bit unsatisfied with the final result. So I did 8 millimeters of expansion. I first tried the MSE, which is a brand of MARPE. It failed. And then my orthodontist worked with some like local machine shop company to fabricate this custom expander that had extra screws, and they were like pointed off axis, so they were more stable. And that worked.
What year was that she did that?
2020.
Yeah, that's very early for custom.
Yes.
I wonder if it was Partners Dental Studio or if it was a custom MARPE that she just had another lab do. I don't know how up to speed you are with the MARPE space.
Oh, nothing.
Oh, yeah. So to make a very long story short, since 2020, so 2019 I had MSE type 2. 2019 to 2020 we started seeing people customize MSE type 2, adding, wings that went into the roof of the mouth to aid expansion, sometimes even adding extra TADs to MSE type 2, sometimes even doing multiple MSE type 2s to like tandem MSE they called it, just to try to get more balls out of the appliance basically. Enter apparently 2020, but definitely in 2021 we had Partners Dental Studio via Dr. Ilya Lipkin enter the scene, creating custom MARPEs that were custom built based on patient scans that would fit snugly into people's palates and had as many TADs as you wanted, and the TADs went wherever you wanted them to go, and you could really shape them however you wanted. They were totally customizable, and that's when success rates in terms of getting splits went up. Custom MARPE did introduce new problems, but the split rate went up.
And sorry to interrupt, you had the regular MSE?
MSE type 2 with a little bit
2.
of custom business going on with it. It had these wings that acrylic. So it was an MSE type 2 with bands that went to the molars. So it was not a freestanding MSE type 2 with no arms. It had arms, and attached to those arms in between the teeth in the midline were acrylic wings that were meant to anchor onto the roof of my mouth to provide a little bit more anchorage.
Do you think you would have gotten a different device, a custom expander, if you had done this today, and would it have changed anything for you? Or
yeah. Oh, for sure. Yeah. I consider MSE type 2 obsolete for anyone older than, let's say, 18 years old now. There's no advantage that it has over a custom MARPE that's properly built and properly oriented, or an FME, which is another brand of MARPE that is custom built based on patient scans, and it is way more robust, way more precise, has so much more strength and cephalometric planning that goes into it to prevent asymmetry than MSE type 2. So yeah, if it were me, I would do like a FME, or a really nice, armless custom MARPE.
What do you think that would have changed in your experience?
I don't like to talk about my case too much, but since you asked, I think that I had screw drag with my appliance. So
Screw drag, yeah, me too.
yeah, I think I had my appliance basically expanded one side, but then cut through the other side, so that there wasn't a lot of expansion on my right side, and there was a lot more on my left.
Mhm.
And I think the vector of that expansion was not ideal as well. I think on my left side, I had a little bit of a drop, and I think a little bit of a yaw problem where the left side kind of rolled forward.
Wow.
So I would have done a lot of things differently now. It was the Wild West back then. There was not a
Yeah.
lot of cases that could be used as examples to learn from.
I think you were the first case I had heard of. So yeah, you were definitely like right there on the frontier.
Yeah, I was the first case I had heard of at the time.
Really?
Yeah,
Wow. That's
yeah,
amazing.
yeah. I would use the same provider, Dr. Nuaz, but I would use FME with Dr. Nuaz. So yeah, Dr. Nuaz has sort of had a parallel journey to me in a lot of ways, where we both started at that time with MARPE, and we have both kind of continued on in the space, and now he's really like latest and greatest. He's got 100 FME cases under his belt. A lot of them are incredibly beautiful. The complication rate with them is super low, so he hasn't missed a day in terms of refining his process and doing things as good as possible in that, with that procedure. So yeah, but it's a whole new world compared to 2020.
You
But
two braved the way for us.
well, I would count you among that class as well, Evan.
Thank
Certainly,
you.
you're an OG. You're an OG of this. You're the jaw surgery goat, man.
Yeah. There was a few YouTube videos I watched that were jaw surgery before me, but more for aesthetics. Um, yeah.
Yeah, I mean, you're the guy that is as many voices as there are screaming people off the jaw surgery ledge. There's that one pearl in the murky waters, which is Evan, which is like, nope, sometimes this really does go well,
Yeah.
and
Oh,
like
thank you, my
gets you
friend.
exactly what you're looking for.
Yeah, well, if there's one thing I want to like kind of nail down in people is that when you hear about like, oh, there are more minimally invasive solutions we can try first. If a doctor tells you that, it might seem so reasonable. Like, of course you would try less minimally invasive, or sorry, more minimally invasive, less invasive techniques first. Um, but that's not really actually logical. What if the less invasive technique has a low rate of success and it's more dangerous? Just because something's less minimally invasive does not really mean it's an appropriate solution to your problem. There are no isms. There's just no like rules of thumb that you can follow. It's just not that simple. And I just feel like there's so many patients who get led into these like suboptimal corners, and then it complicates their case more in some other weird way. My uncle just got like the Inspire implants that like electrocutes his tongue every time he breathes. And it's like, dude, like that's like his jaws, man. Like, what are you doing? So I think jaw surgery is like, it just is the only thing that solves the root problem for most sleep apnea patients. I mean, maybe it's not most. I have never, I don't know for sure, but I don't know. There's no alternative to solving the root cause. Not to say it's the cheapest and safest surgery, but I don't know. I was just like desperate and looking for anything. So I don't know. I am a huge fan of jaw surgery. You know, of course I'm like biased, right? There's a confirmation bias. It worked well for me, so of course I'm gonna speak highly of it. But
Yeah. Yeah, I think the point that you're getting to is what I've often called the less invasive fallacy, which is
mm,
that treatments that on the surface appear less invasive, such as tooth-borne expanders, right?
that's the big one.
They're actually more invasive in some significant senses. Sure, there's no bone being cut. Sure, there's not a lot of risk of numbness or looking like a completely different person that you don't want to look like, although we certainly did see a lot of that with AGA. We saw people losing their teeth and looking like freak shows.
Which was the one that you had a tooth-borne expander before? Is that right? Or
I
am
had
I
a couple.
misremembering?
Yeah, I had a
Yeah.
couple. And that's, you
Yeah. So
know, a
you would
lot
know
of
more than
people did at
anyone.
the time. A lot of people did. There was a whole craze. I would say the tooth-borne expander craze was 2017 to 2019-ish, before MARPE was on the scene, because there was no other option. It was
Yeah.
either tooth-borne expansion or jaw surgery, and jaw surgery was terrifying because there were no surgeon podcasts really to watch where you could familiarize yourself with the procedure. All you knew was that your face was going to get hacked off. You had a lot of the big influencers in the space, such as the doctors Mew and other doctors, who their whole premise was let's avoid jaw surgery.
Yep.
So you have a lot of trust establishment with creators in the space and with providers of tooth-borne expansion who are very active on social media, and they're drilling in this foundational starting point of their whole operating philosophy, which is jaw surgery bad, do this instead. And so you just write it off as not even an option. But yeah, tooth-borne expanders, although they're less invasive in some senses, are more invasive when it comes to, I mean, tooth damage, periodontal risk, right? Losing teeth, losing root health, losing gums, losing money, losing time, having false expectations about the potential efficacy of treatment, discomfort, like these things suck, like you wear them for 2 years and you essentially get nothing or very little for it in the way of real airway benefit. There was a lot of deception around what was actually happening with the mandible. You know, people were jacking their front teeth forward and then sliding their mandible forward and were being told that their mandible was somehow growing when really it was just repositioning, and that's risky for TMJ health. I mean, the whole thing was shrouded in like this kind of misinformation. It was
I think you nailed it.
yeah, and there's nothing non-invasive about that. It's like physically invasive, mentally invasive. It's spiritually invasive because it's
Financially.
financially, it's this kind of, yeah. Whereas, yeah, sure, jaw surgery is risky, but if it goes well, and that whole thing can be planned, right? There's ways of mitigating risk with jaw surgery, and I think you probably have a lot of insight as to how that's done. If it goes well, it can be really powerful and safe.
Yeah. Absolutely. Yeah. You nailed it. No comments. Yep.
So, what are your big pieces of advice that you would give to people? What would you do differently if you could? Anything?
Um, I think big pieces of advice. I think that the one of the things that's difficult is that, as you, I'm sure know, MARPE is not one thing. Jaw surgery is not one thing. We've already talked about down grafting versus impaction, and we've talked about Genio and the different expanders. It is really overwhelming to try to find the right solutions for you when you're going to different doctors and hearing different things. Gosh, I don't know that I have a good solution for that, but I have known a lot of patients who have entered a analysis paralysis, and year after year has gone by and they kind of loosely consult and not jump in. There comes a time when you have to kind of jump in. I think that like sleep apnea in and of itself is it's a horrible disease. It has long-term implications on your health. And yeah, like I think work with a therapist to kind of manage some of the anxiety so that you can move fast, slowly. You know what I mean? Like, don't let a whole year go by where you have all this information and you haven't taken any action. Um, I didn't do that, so the question of what would I do differently is a little bit different.
You mean
I
you did work with a
Yeah.
therapist and you did
Mhm.
move fast but slowly and carefully and with
Yeah.
clarity?
Yeah,
And
exactly.
uh, you're the first person I've heard make that type of comment. Yeah, can you unpack that a little bit? Like, who was this
Sure.
therapist? Where did you find them? Did you go to them because of your fear of jaw surgery, or had you already been working with the therapist? What was the story with that?
That's a good question. I was working full time in 2019 with sleep apnea, and I was not doing a good job. I could not hold a job, and so I was fired. Part of why I was fired is because the office shut down. So, but I really think that I was kind of a pain in their thorn for that year of like they were paying my salary and I wasn't producing anything, which I don't feel good about. And so I got fired, and I was just at a really low point in my life because my symptoms were really bad. At this time, I was wearing a CPAP machine, but it wasn't helping. But every doctor told me that's not possible. CPAP helps. The only possible way it wouldn't help is if you're not wearing it. We now know that's not true, but I just kept hearing that. So I'm like, every doctor was telling me it's not your sleep apnea. You just have some other co-occurring condition like depression. And so I just didn't have answers. I didn't know that my sleep apnea was still occurring. I had a sense because I was waking up throughout the night constantly, short of breath. But I guess I was maybe being like unintentionally gaslit by doctors. But I don't even know if it's unintentional gaslighting. That doesn't really make sense. But um, I was just not really doing well in life. My relationship with my family was really bad. And so
Why?
I saw,
Why?
good question. I come from a family that has a lot of trauma, generational trauma. I come from a family of Jewish refugees on one side from Eastern Europe, on the other side from Iran, which are places that have experienced, religious persecution on and off for thousands of years. And the effects that that has on mental health is just like hard to quantify, but it's definitely there. And so I think like my entire family struggles with mental health. I don't know like anyone in my family on either side that doesn't have like severe mental health issues. And I think I was really lucky to grow up in LA, which is a place that's pretty accepting and diverse and pro mental health and stuff like that. So I I was able to sort of like not have to fall into this. Growing up in Judaism, it's there are good things and there are bad, but it can be a pretty exclusive environment. And I was lucky to have other options. I had other friends that weren't Jewish. That's not an opportunity that my family has had in their home countries. So
How is it? How is it like exclusionary? It restricts the people that your parents encourage you to hang out with, or the kind of career that you might
mhm.
get into, or
Yeah, that's right. It varies wildly. There's Reform Jews, there's atheist Jews, there's Orthodox Jews, there's ultra Orthodox Jews. But Judaism is notorious for being one of the few religions that doesn't recruit, doesn't have an interest in recruiting. And I mean, biblically, the Jews are God's chosen people. And so, I think a lot of Jews don't really think that they're, you know, holier than thou. And I think that a lot do. But then again, you get that in every other religion. I'm atheist. Um, but another thing too that I think is very difficult is like in Iran during the revolution and before the revolution, there was an era of anti-Semitism. And so I'm not everyone who wasn't Jewish in Iran was anti-Semitic, but there was quite a lot of stuff where like if Persian met another Jew, like they would hesitate to shake their hand, or they were kind of thought of as a little bit dirty or conniving or weird. And so a lot of Jews in Iran and around the world like kind of decided to that like the only way to survive was to create their own kind of insular communities, and they overcompensate on that feeling of being perceived as dirty by trying to like really uphold this like functional image. Like a lot of my members of my extended family are like very, very interested in designer clothes and nice cars and, you know, tens of thousands of dollars for a bag and stuff, the ones who can afford it. And I think a lot of that is a trauma response, like being religiously persecuted, being thought of as kind of dirty, needing to stick together to survive. It kind of like brings out a lot of like lizard brain hierarchical survival mechanisms. I'm not a professional, like I'm not a psychologist, so I could be totally off the money, but that's how it's definitely felt.
And that sort of cultural isolation combined with the fact that you were a sick kid and that you maybe saw yourself as ugly physically because of your jaw structure, it just kind of made you feel ultra separated from the kids that you were going to school with, et cetera, et cetera. And then your family was constantly reinforcing that, and it just led to a kind of tension. I'm not sure I totally understand. And
yeah,
don't let me speak for you.
No, yeah. I'll just to like kind of bring it home. Like I grew up with a very angry father, and my dad struggled and still struggles with depression, and there's just like long lines of abuse. And so growing up and even until I was an adult, he's changed, but very, very angry father. And so when I started going to therapy, I told the therapist, hey, I need help navigating poor health. And pretty quickly it started to encompass family dynamics as well. And so I went 5 years, which encapsulated my entire jaw surgery journey without contact with my family, save for my sister and cousins who are like my age, and they're like, you know, my just people who I like love and trust dearly.
Yeah. And have you since made contact with your family?
Yeah, we tried family therapy, like it felt like once every year or 2 years, and it went really poorly. And then we had a break from it, and then a few years after that we tried again and found some success. And so over the past year, we've been kind of like slowly reintegrating into each other's lives, which it definitely is something I'd never thought would happen. And I think for many people can't happen. But I think in some ways I'm lucky, but yeah, I now have like a relationship with my parents that is functional. And we're not in family therapy right now. I don't think that's possible for everybody, but yeah.
Like if your dad were sick, you would go visit him or something?
Yeah. I see my parents like once a month. Something like that, once, or maybe sometimes twice a month, something like that. My grandma will host Shabbat dinners, and I'll go once in a while and bring my girlfriend. So it's definitely, I think like the years have, like the tension has kind of calmed down, and a lot of resentments have come down on both sides. So
is you being healthier, does that take a weight off of the whole situation because you're coming from a better place, so you can kind of lift people up to where you're at a little bit more?
For sure. Yeah, I have had throughout my jaw surgery journey like an incredible amount of hate in my heart. And I don't blame myself for that. I think that was the correct feeling to have. I think that hate is not good or bad. It's misplaced hate that is bad. But there's no way that if I had still been struggling, I think I would have been able to like alleviate any kind of resentment. But I didn't really have the chance. I think my parents needed a lot of time themselves to sort of like take a step back and kind of see how they had been behaving. And so I think it was both sides.
Was there a financial tension where there was, you were sort of dependent on the bank of dad, and yet you also didn't really like hanging out with dad, and so it's like you can't live with him, but you can't live without him, and that just led to bad places?
So no, it was a little bit the reverse, which is funny. A lot of, and I may be overgeneralizing, but certainly my family is this way, and I think a lot of Jews have a lot of, they just have this part of their brain, and I have it too, so I'm speaking from personal experience as a Jew, have a part of our brain that is just always on, trying to consider how we're going to survive through some sort of like religious persecution disaster. I think a lot of like refugee families feel that way, and even the children of them. And so my family is very, very concerned about money. Always has been, even when I was a kid and I came from a wealthy family, or when they were in Iran and they were even wealthier, there's always just this fear that the pin is going to drop and everything's going to fall and the value of money is going to turn to zero. And my family was always very hesitant about money, and the recession hit them very, very hard. And
like the '08 recession?
Yeah. I had a...
Oh, how old are you, Evan? How old are you?
I'm 30.
Oh, okay. Yeah, I'm 35, so not exactly of the same class, but yeah. But you probably don't remember '08 that much, except actually in some ways because you were just like a middle schooler. That must have hit you even harder than it hit me, because I was graduating high school, so I could at least be sort of self-sustaining, even though like my dad's whatever 401k was getting trashed.
Yeah.
But you were probably internalizing and living firsthand a lot of his suffering at the loss of net worth.
Yeah. Another thing is that a big part of like my family's culture, I don't know if it's from the Persian, from the Jewish, or from both, is that there's a really big expectation. There's a word for this, but sons taking on this parental role for their parents. And so I had always kind of been set up to be this like, I don't think prodigal, but like the son that is going to like get an engineering job and make enough money to care for my parents. And so that was sort of the expectation, both implicit and explicit. And so I think like when I started to like, when I got fired because I wasn't performing because of my health, I think my parents wanted to kind of like plug their ears, like, like my safety net is going away. And so I didn't have the golden handcuffs. I had the pressure of providing. And so I was like, no, like I can't help you. Like, and so I ended up just being lucky enough to have enough savings to get through the surgery, which was really scary because I felt like had I not had a high paying job, then I wouldn't have been able to get through it on my own because I didn't have the support of my family, which I think like leads me to believe that money buys you happiness. Like it is so important for safety. It's so important for escaping abusive situations. Like it's, that's probably part of my like, Jewish traumatic brain speaking, but like, yeah, like having a high paying job, having money saved my life.
Yeah. I don't disagree with that. I think that it's a cliche, but money might not make you happy, but being poor will certainly make you miserable.
Yeah.
And I also think that that doesn't necessarily mean you need to be a millionaire to be happy. It's more just like you need to be able to pay for housing. If family is a priority to you, you need to be able to support a family. If you can't afford health insurance, or if you can't afford to pay for a life-saving jaw surgery, that's obviously going to detract from your happiness. And to my mind, that means for like a single person living in a place like LA, that means something like $125K a year is probably like enough where money isn't making you miserable.
Yeah.
But yeah, I want to emphasize, I'm not a believer in like the infinite growth Alex Hormozy model of like the purpose of life is to scale until you're worth 100 million. It's more just like, I mean, I'm a big believer in give us this day our daily bread. And I don't think that's human instinct, by the way. I think that human instinct is to hoard and to accumulate and to even irrationally. Like humans are hoarders by nature. We're survivors. We like to put away for the future. And I do think that like a big message from Christianity is that like you don't necessarily need to hoard. It's like God will provide for you every day, right? Give us this day our daily bread, not our monthly bread or our yearly bread. But that still to me means it's more like a month-to-month thing. It's more like give us this month our monthly bill payments so we can pay rent and buy groceries and eat food that's reasonably healthy. Money's a tough one, and the economy is horrible for a lot of people right now, and housing is insanely expensive. And the other thing about money is that when you don't have a lot of it, and this is something I learned from my Buddhist teacher, Ajahn Jeff, the best thing about being wealthy is that it protects your morality. Assuming you don't lose your morality on the path to becoming wealthy, because that can happen too. But I think that mostly happens in the infinite growth model where you don't have a sense of what is enough. And so you start doing sinful things that hurt other people. You essentially start hurting other people in this effort to attain more and more and more. And I also think that when you're very poor, you're more likely to do bad things that hurt people in order to make your payments. And so, that's what he meant when he said that being wealthy protects your morality so that you don't have bad karma and then bad rebirths. And that's a cosmological discussion. We don't have to go there. You've already stated your position on that, which is that you're an atheist.
No, I love hearing it.
Yeah, well, it's like it is nice to not have to be tempted to do bad things to make money. Yeah. But, of course, you need to already have money to be in that position.
No, I totally agree. And I think like one of my favorite teachings of Jesus was that, a lot of people will say that the pursuit of wealth and whose toes you step on can be immoral. I think one of the things that Jesus teaches is just a certain level of wealth, even obtained fairly, is a sin. It is bad. And I think that that's true. Like if you became a billionaire because you saved lives, that's unethical. That's an unethical thing to have done.
I'm sorry, did you say if you became a billionaire because you saved lives, that would be unethical?
Yeah.
Yeah, can you say more about what you mean by that? I actually don't.
It's a form of hoarding.
Yeah, I don't know if I know any billionaires that have become billionaires doing good things.
You make a good point. I know that a lot of people maybe like there's billionaire philanthropists who are thought of as like good people, like Bill Gates, and maybe they are. I mean, but I think what is the one quote about it's easier for
to drive a chariot through the eye of a needle
than for a rich person to get to heaven, something like that, right?
Yeah. And so are you making the point, and I don't know if you're just restating a biblical point, that just even seeking to add that money to your bank account to exorbitant numbers, even if you're doing that by theoretically curing cancer, is still kind of like maybe the sin of greed or the sin of pride?
Yeah, it's a hoarding of limited resources. Whatever you gain takes from others. And, if you're able to support your family and you have a house and, that's totally fine. But if you have the amount of money to like own a city or a portion of a city, I think that's when it becomes unethical. I don't think that surgeons are necessarily in this case, but sometimes it does feel unethical, like how much surgeons charge to help desperate people. But I'm not going to go there because I don't think that they reach the level of wealth that I think is unethical. But like when you have enough power to like rise above democracy and disproportionately affect the way the world works, even if you use that money for good, it should not really be tolerated. I think it definitely doesn't seem to me like a Christian ideal. But that's kind of my own rant, and it's from my own, limited point of view. But Being extremely wealthy is a form of hoarding.
Yeah. So, but as an atheist, where are you coming from with that? Is that what's like the foundation of your belief that that's the case if it doesn't come from what you consider to be natural law that comes down from God?
Oh, I love these conversations. I find them so fun and interesting. I think that ethics evolve. The propensity to do good is part of our genetic code, and the propensity to do bad is part of our genetic code. There's a little bit of nature and nurture in there, but I think that when I think about fairness, I think about it because I evolved to think about it. So I think that's where it comes from.
So fairness is a kind of adaptive trait that keeps communities together better?
Yeah, like species who are able to collaborate by developing concepts like fairness have an advantage over other species and other maybe warring tribes. On the flip side, individuals who seek to take advantage of others also have an advantage if done well. So there's a warring evolutionary push and pull for people to do good and to do bad. We've evolved to do both.
Do you think one is right and one is wrong?
I think that when you think about it in the cosmological sense, right and wrong are human-made ideals. But if you allow yourself to draw a boundary around from the perspective of a human, there are things that are objectively better or worse for the collective well-being of humanity. And if something is objectively better, it's more likely to be good. If it's objectively worse, it's less likely to be good. There are exceptions, like maybe if there's limited resources and the world is starving, it's objectively better for humanity if you like kill yourself. But there are carve outs where I don't agree with, but ultimately, yeah, so cosmologically, no, but in the pursuit of the well-being of humanity as a whole, yes.
Do you think that, generally speaking, in the pursuit of the lifting of the well-being of collective humanity, that the inclusivity, the sort of love thy neighbor, turn the other cheek, give us this day our daily bread approach to life, let's call it, can we call it the Christian life? I don't know.
Yep.
Those certainly seem to be values that Christ espoused. Do you think that Christianity was like a practical message that arose during a time of globalization where the world was kind of transitioning from a world of tribalism and sort of city-states that didn't really have a lot of contact with each other due to technological and geographical limits, enter the transition of the Roman Republic to the Roman Empire, and all of a sudden we have all of Europe and Eurasia kind of interacting, and then this sort of tribalism becomes toxic in that environment because then you have people identifying primarily with their ethnicity or their religion instead of with this broader sort of Roman identity, or as Christ tried to teach, this identity of us as humans and as children of God. Like, do you think that in that context that the Christian message was beneficial to humanity?
That's a fantastic question. I'm going to answer that. Let me quickly switch off of my AirPods because one of them died. I think that means the other one may die soon.
Sure.
Yeah, that's a really good question. I think this is like bordering the territory of like archaeologists and historians. I certainly like a lot of the teachings of Christianity. I think some of the teachings I don't like. But what did it mean in the context that time in history? I've seen it explained different ways, and I don't personally have any intuition about which one's more correct. But I think I was listening to one archaeologist who was saying that, like, you know, Jesus was one of many, many sort of magic kind of cult leaders that were sort of rising against the Jewish establishment. And he was successful because his murder was kind of internalized him into a figure. I have no idea if that's true, but it's kind of like I find it really difficult to think about like what were the actual intentions of the early Christians? What were the intentions of any early authors of any religious text, of religious like movements? I've personally felt that like to be a religious leader requires some level of egotism that I don't understand. And when I think about every religious leader of like modern day, I always feel a huge sense of skepticism over their intentions. And when I listen to the things that they teach, I often agree with a good portion. So I find it impossible to like consider how benevolent the movement was. And I sort of guess we'll never know, but I think I can appreciate the good things that it has done. I think my favorite being um, extend, I think a big part of the Christian movement seemed to be extending the Abrahamic faith to all. Yeah, as I said before, I'm like really not a fan of Jewish exclusionary culture that is written into the Bible. And so I like the idea that, this is a religion for everyone. Certain. I think that seems to be like one of the biggest differences between Christianity and Judaism. As I said, there's other things I'm not crazy about, but I think I definitely see merit in what you said.
Do you consider Christianity a version of Judaism? What exactly what does Judaism teach with respect to what Christianity teaches? How are they alike and different? I'm not sure because Jesus was Jewish or part of what would you call it? Israel? Was that Israel? Or Judea? I don't know.
Yeah, I don't know. Born in like Bethlehem it's all sort of part of the that region.
I know he visited Lebanon, which is like props. That's awesome. Like because I'm Lebanese, so I know he visited some of the southern Lebanon cities. But yeah, he was going up and down that eastern Mediterranean coast. But yeah, what are your thoughts on that?
They're all derivatives of one religion. I don't know that. I don't think you can technically call it Judaism because when you say Judaism, you necessarily Christianity and Islam and Mormonism. They are all what are called Abrahamic faiths because they all have the same Bible. That's not 100%, but they all believe in the majority of the Old Testament and Noah's Ark and Adam and Eve. And so these are essentially denominations of the same religion. And a lot of their teachings are similar because, there are things that like certain religions have sort of denounced, like Christianity has reverted dietary restrictions like eating pigs, but Islam hasn't. There's like little differences like that, and then there's bigger philosophical differences like how Christianity is more inclusive towards all people. Islam is more inclusive towards all people. There's no restrictions on who is allowed to be part of Abrahamic faith. But it's like when people argue about the differences between like Shia and Sunni Muslims or Protestant and Presbyterian, it's not that crazy to also extend that analogy towards Christians and Jews and Muslims and Mormons. Like they're all derivatives of the same Bible.
Yeah, and exclusionism can occur within even the inclusive religion of Christianity, which is probably more of a perversion of the original message. But what about with bringing this back home to your jaw surgery? I'm trying to gauge how much this jaw surgery actually affected who you were in your everyday experience of the world and of some of the core beliefs that you have. Like, I had one person that I interviewed once who said that improving his airway actually had a spiritual effect on him, where he became more kind of in touch with what he said was God, because he was sleeping better, his mind was sharper, he was getting more pleasure just from being in his own body, he was less tortured just from sort of being in the meat suit. What was that like for you?
That's a good question. Yeah, I think some people like adversity brings them closer to their God, and for some people, adversity brings them farther to their God. I'm not a good person to ask because I've never, I think like past the age of 12 or 13, I've never really felt strongly that God exists. And my surgery didn't seem to like affect.
Did you
I give
feel
a better answer.
did you feel like a totally different person after surgery? Was it like putting glasses on for the first time where, you went from blurry to clear, or was it more subtle than that?
It was dramatic. I think one of the interesting things that I learned, and I'm kind of learning it now, it's something I think you can kind of learn forever, is that like we assume that we see the world from this like logical point of view, but our proclivities to be irritable or charitable or skeptical or gullible, like these are things that are, we think of them as like innate to our personality, but they can swing so far left or right simply by something going on in our bodies and in our health. And that was my experience. Yeah, like it was, yeah, it's kind of shockingly different. The only thing that made it less shocking was that the progression of sleeping better took like 8 months, 9 months. So
Wow.
it was gradual, but if you just cut that time out, it was pretty different. Yeah.
So would you say you're still healing, or would you say that all the healing occurred within the first 8 to 12 months?
Yeah, all the healing. But yeah, like the physical healing probably happened within the first 6 or 7. But I think it takes a while to like, I'm guessing it takes a while for your body to learn to like sleep normally again and breathe normally.
Did you become a better skater? I know you skateboard. I used to skate, by the way, when I
Oh, no
was
way.
younger.
I
Yeah.
didn't know that. That's
Yeah.
awesome.
Yeah. I was all right. I could do a kick flip. I could do a heel flip. I could do, I remember visiting LA once when I was in the sixth grade with my dad, who used to live in LA, and I know there was a big skating culture in LA in the late '90s, and I remember my whole vision for going to LA. I was like, oh, I can't wait to go to the skate shops and look at the decks and maybe buy a skateboard and meet some cool skaters on the West Coast. I'm from Massachusetts. Yeah, but when I guess this was the year 2000. It was right before 9/11 that I went to LA with my dad. But skating was my whole world during those 2 or 3 years of my life. I built a quarter pipe.
Oh, sick. Do you
Yeah,
remember what skate parks in LA you visited?
I didn't go to any skate parks. We just hung out on Redondo Beach and
Oh, I used to
Manhattan
live there.
Beach,
Yeah.
and I didn't actually get to see a lot of skaters. Because I was just kind of following my parents. I was like 10.
Yeah. That's cool. Honestly, being able to kickflip and heel flip at 10 is impressive. Took me a lot
Yeah,
longer.
I actually still can. It's amazing how
Oh,
much muscle memory that is.
that's hilarious because if I feel like if I don't skate like every 2 weeks, at least like every week, like I lose everything. It's like I'm always impressed with people that are like I have friends that are like that. Like they quit skating and if they just pick it up, yeah, I'm not like oh, I just like all my effort goes into like trying to slow down the rate at which I get worse.
The fight against entropy.
Yeah. Yeah.
All of life is just a fight against entropy and the inevitable, dissipation of relationships in the body.
Oh, it's sad to consider.
So, but how has your skating been since surgery? Did you have to avoid it for a while so that you didn't injure your face and mess up the stability of the surgery, obviously?
Yeah, that was part of it. Also, like as I became more and more tired, it was just became such an insurmountable task. This is a little surprising, but I've definitely gotten worse post-surgery. I think
Oh,
that's kind of unrelated. I think I had a falling out with a lot of like my main skateboarding friends that I was skating with every day, and so I just stopped skating nearly as much. And I guess haven't really found the groove in life to be skating as much as I want to. I'm still working, but I think I have the capacity to be better now because of the sleep apnea. Unfortunately, it didn't really materialize that way.
yeah. Why did you have a falling out with them? Was it something related to jaw surgery, or was it politics or something else?
it was a personality thing. Like these were kind of like toxic masculinity friends from college where we were all like cringy, overcompensating males reading red pill and stuff. And I think, we all grew out of that to varying degrees, but in sort of very varying degrees in different directions. And I think our friendship was always a little unhealthy. And as I started to like therapy and stuff, it started to be a little bit harder to maintain friendship. I don't have any like feelings toward them. Like I still have some love for them in my heart, but I just found like that the kind of toxic, I'm very now sensitive to toxic masculinity. Like if I'm in like a very machismo space, I just like don't really feel very comfortable. Whereas before, I still didn't feel comfortable, but I told myself like belong here because early man, which is not true. And I think I've just accepted that like these are not places I feel comfortable in.
Did that transformation happen before your jaw surgery or after?
Before.
Oh, really? So it wasn't just that you became the machismo and then therefore you were able to let go of the sort of community side of it. It was like a vehicle that took you somewhere and then you let it go, or that's not at all what happened?
No, it was therapy. Which, yeah, my falling out happened before jaw surgery and a little during. It was around that time, but.
Yeah, wow. So tell me about something you mentioned very briefly earlier, which is something relating to a pressure that you're feeling. Is that in the joint or is that somewhere else?
It's in the joint. This is something that's a little bit hard to explain, and I want to make a YouTube video about it because it's a very visual thing. But try. I think I have the same little diagram skull, but I think it's in a different room. But let me go grab it. I'll be right back.
Okay, yeah, sure. Take your time.
Okay. I got the same little skull. Oh, I realized the colors are a little different.
Oh, yeah.
So here's my understanding is the lower jaw here is shaped like a V. It's narrower in the front and wider in the back. And they cut it, if you look online at a diagram, how they do the bilateral sagittal split osteotomy, BSSO, I'm probably butchering that. They cut it sort of in line with the ways that the jaws are already moving so that there's an outer piece and an inner piece that slot. And when you pull the jaw forward, those two pieces slide against each other. Now, the thing is, because this is V-shaped, and I try to do a better job maybe in a future video, when you pull this jaw forward, again, you have three pieces. The BSSO cuts your lower jaw into three pieces. One, middle, two. So like right, middle, left. When you pull the middle forward, these must flare out in order to make space for this to move forward. So when these right and left pieces flare out, you end up creating a vice where, because these flare out, the joints flare in. So it creates a tension. It basically squeezes your skull into a vice. And the more you advance, the higher that pressure becomes. And that was my experience. So luckily I still have like functional joints, but there's a pressure and it causes like a low grade headache kind of all the time.
Oh, wow.
Yeah. So that's definitely the biggest consolation or trade-off or side effect that I've had to deal with, is just that pressure pushing into my joints.
Is it getting better?
No. I don't think so.
Can you live with it?
Oh, yeah. It's it's such an easy consolation to make considering how much better I feel every day. There are other kinds of lower jaw cuts that don't flare out the left and right of the mandible that way. Like one of them's like an L cut where they just, but I don't know. They all have their own trade-offs. This I don't quite understand nearly as well, but I can definitely live with it every day. Like it's so small in comparison to how I was feeling.
Yeah. Wow. Do you feel like, so it's not a matter of 3 steps forward, 2 steps back. It's more like a matter of 5 steps forward, 1 step back?
Yeah.
Would you say that's about it? It's like 5 times better than worse?
Yeah. Maybe even more. It's so
Wow.
minor. It just doesn't bother me. Like, I have poor posture, which I also think was a product mouth breathing as a kid. I think the poor posture bothers me a lot more than the jaw pressure.
Have you worked on the posture deliberately?
Yeah, I went to a physical therapist. Maybe I didn't go to the best one, but I didn't. It's a difference. We did like before and after pictures. Thing changed. I sort of wonder if like when you grow up that way, your skeleton shapes differently, and it can't just like change with exercise, like almost like the tooth-borne expander. Like maybe it's the same thing. I'm making shit up though. Be true. Maybe I didn't do work enough when they gave me exercises.
Well, yeah, neck posture and jaw surgery, or let's just say neck posture and airway health, is a really complicated topic, and there's a huge amount of, actually, it's very consequential debate, really, because what I learned recently was that a big part of how different surgeons plan their movements is based on anticipated changes in neck posture. So, for example, if a surgeon feels strongly that your neck posture will kind of elongate and neutralize after jaw surgery, like go from this to this, they will do a bigger advancement because essentially they expect that you're going to tuck your jaws in like this, which means they can take you further without you looking prognathic. But other surgeons just think, no, your neck posture is your neck posture, and so I'm not going to assume that you're going to tuck your jaws in 5 or 6 millimeters, so therefore I'm going to advance you 5 or 6 millimeters less so as to not make you look overly advanced.
That is smart.
It's a key part. Yeah, and so and that decision can be affected by whether or not a patient is working with a physical therapist on their neck posture, what their kind of motivation is. Are they someone who could potentially work on neck posture in the future to ameliorate some of that big advancement and tuck it in, so to speak, with good neck posture? But to be clear, did your neck posture change at all for the better, just kind of naturally as a result of jaw surgery?
I thought it would. I haven't noticed a change. I also thought my voice would be different. I haven't noticed a change. Yeah, no, I haven't noticed a change in my posture. I thought there would be. I really don't have a good explanation. I wouldn't be surprised if other people said their posture improved dramatically.
Do you work at a computer for a living?
Mm-hmm.
That's probably not helping, right?
That'll do it.
What do you do for a living, Evan, if you don't mind sharing?
I'm an engineer.
Oh, okay. Of a specific kind?
Yeah, I do machine learning and artificial intelligence, so kind of like a software engineer. Although I studied electrical and computer in college, and
no big deal.
Yeah, I like it. I love math and programming, and I specifically work in a subfield called computer vision, which is when computers ingest imagery from a camera or video, and you use AI to have the machine automatically tell what it's looking. So, fun example that a lot of people are familiar with is like self-driving cars. How does the car, I don't work in self-driving cars, how does the car perceive its environment? That would be computer vision.
So then you're the guy who's going to work on the AI-assisted jaw surgery planning software of the future?
Yeah, that would
Dude,
be cool. If that
why
was
not?
what I could get, I think it would be fun. I work in defense now, so I work with like satellite video, which I find fun as well, but that I think sounds even cooler.
Well, we could probably frame this as a defense adjacent business model where we're trying to optimize soldier anatomy, right? Let's make them more. I mean, isn't there a long history of that, of training soldiers to be, more physically optimal so that they can be better killers in the field?
I would believe it. I work in an office of nerds like me where none of us have any like physical prowess at all, and we just work on like satellites and technologies and stuff like that. So I would believe that, but it's a part of the government that they definitely don't ask my input for.
Yeah. Yeah. I just think that like obviously you worked with a great surgeon, Dr. Walin, and there are many other great surgeons, but I would say the average surgeon is not just drawing up a beautiful jaw surgery. And I wonder when this problem of like mediocre jaw surgery plan design is going to be corrected with software. Because it's like not that hard of a problem to solve. I mean, it's way easier than, it's a static thing. It's like, here's point A. We need to determine what is the ideal point B. We need to determine if this is surgically feasible.
Yeah.
And then we need to have the software convert to physical hardware that makes the surgery possible. But right now, surgeons are doing this by hand, essentially. I mean, they're doing it, there is virtual surgical planning, obviously, and pretty much everyone uses that. But when I say by hand, they're tracing in the computer manually these movements.
Yeah. I think you're right. I think we have all the parts. There's the CT scan. You've got a 3D model of your entire head, including the soft tissue of the airway and the bones. You've got the imagery. I don't see why you wouldn't be able to like do better in the software to create like a automatic AI created suggestion where then you can have like a Blender 3D model of your face and what it's projected to look like after, and how maybe even measure like how tense your upper airway tissues will get, and how that sounds possible.
How about this layer? Tell me if I'm full of shit. You take data from dating apps.
Oh.
You have the patient tell you what type of partner they're interested in. You take the data from that type of partner and you see what type of face they swiped right on the most. You determine an ideal phenotype of what you want to become based on your starting point, and then you design the jaw surgery based on that.
I love it. Yeah, it's like anchoring objectives to like some external goal. That is fucking hilarious. That sounds good.
Well, someone told me recently that dating apps are having a really hard time monetizing, and they said that like essentially they're not doing very well at monetizing their biggest asset, which is not actually necessarily the ability to connect people who want to date, but it's actually just all of the data on what people actually find attractive.
Oh.
Not what they say they find attractive, or not what we think they find attractive, but what people actually find attractive based on 10 years of swiping data.
Yeah, I bet those things are different. I feel like us humans, we're not usually good at being accurate at how we feel or what we want.
Right.
Oh, that's a good one.
Yeah, so I don't know. Maybe I'm full of shit.
No, I'm there with you.
I'm all talk and no action, man. So
Oh,
this is just mental masturbation, man.
Yeah, there's a place for it.
No, that's awesome though. I appreciate your feedback on that. But what any other complications that you had with your surgery? Like what about your surgery don't you love? Like anything that you wish Dr. Walin or anyone else did better, or that you did differently during recovery?
I don't know, little things. I get a glimpse of like wondering if I could have gone an extra millimeter or two. I think that's natural and maybe just like this obsessive, human thing that people feel whenever they get a dopamine hit of some improvement. I feel like I should have done a little more of the exercises because I feel the degree to which I can open my mouth is still not great. I really did not do nearly enough of the exercises that Walin had prescribed. I don't know if you could tell, but is this a normal degree to which people can open their mouth?
Well, we could measure it. I'm told that 35 to 45 is like ideal in terms of millimeters. There's little tools you can use to measure. It does seem it seems like you want to go more, but that you can't.
Right. Yeah, I can't even do 3 fingers. So. Probably.
Oh, damn. Yeah, and it's funny because I had another jaw surgery patient actually a doctor who had jaw surgery, Kim Santiago, Dr. Kimberly Santiago, say that she's also having a hard time opening her mouth.
Yeah.
And I also had Dr. Reza Movahed on a podcast a couple weekends ago, and he said he mentioned specifically in this one case he was documenting how much the patient could open his mouth as something he was very proud of as part of that result.
Do you know if the
that is a bragging point.
Of it?
Where exercise is a part of it, I don't know. He didn't mention that.
No, yeah. Definitely that's something where, and maybe it doesn't really affect me, but no, I feel like it changes the way I speak a little bit, but no, it's just may not be the case.
Yeah, it could be scarring in soft tissue. It could be muscle tension just from how much your mandible was stretched forward, and there's like this elastic band effect of the muscles pulling things backward, which may also be contributing to some of that TMJ pressure you feel is just that the jaw wants to come back.
I believe that.
Right?
I never thought about any of that, yeah.
Yeah, actually, that was another point that Dr. Movahed really drove home was he called it CROS, condylar resorption. I don't remember what the O was, but as a result of jaw surgery. So jaw surgery can often cause condylar resorption. It can create temporomandibular joint problems where previously there may not have been one.
I believe it.
And he's a big evangelist on joint replacement surgery. Like he's done probably more total TMJ replacement surgeries than anyone else. So like this is his thing, is fixing joints that have been corrupted either just from TMJD or from jaw surgeries that were previously done.
That's scary. Jaw surgery is scary enough. You want it to end there, but no, yeah, I believe that entirely.
Have you had any like relapsing or changes in your bite over the last 4 years? Because that's kind of the smoking gun. If you do get CROS, condylar resorption, as a result of jaw surgery, what often happens is you end up with an anterior open bite where your teeth stop touching because your condyles erode up, and then your jaw it goes like this. It goes from here to like this. Because it's the joints are like in quicksand. Yeah,
I'm not having that issue, thank goodness. That's one thing I did want to say though that I noticed, I think there's a big difference between you and I, is like before my jaw surgery, like I had my jaws didn't come very far forward, but I also don't have anything back here. What is this corner called? I used to know.
This is often referred to as the gonial angle, I think.
Oh, gonial angle. Yeah.
Yeah.
You have a 10 out of 10 gonial angle. Like your back jaw kind of is fantastic. I really don't have much there. And so to have such a far forward jaw but have nothing back here is a little bit weird. I think I would have not changed anything, but I could have considered jaw implants where they like add some kind of like plastic or something that like gives you a fake jaw. Again, I don't think I would have done it, but it's something that someone hearing it may consider.
Yeah, did you have prior joint degradation before your surgery? Do you recall anyone ever saying anything about that?
No, I'm lucky. I know plenty of people that do, but my TMJ seems healthy. No clicking or anything.
Oh, good. Thank God about that. Yeah, because another point that Dr. Mova had made to me, obviously he's the joint guy, that I had no idea about, and I've been doing this for 7 years, and I had never considered this. I just learned this a week ago, literally. He says that when patients have prior ICR, idiopathic condylar resorption, in other words, the condyle, the socket, the ball of the joint is getting shorter because it's eroding, then I should know the name, but I don't. But this segment, the long one that forms the gonial angle when it makes the angle with the ramus, it gets shorter. And so then when you do the big advancement, you don't have that definition there because essentially this just doesn't really exist because it's been eroding. And so a big part of what he says is like a positive aspect of total joint replacement is that you can do whatever you want with this. You can make it as long as you want without having to exaggerate the advancement in order to make this more visible.
Oh, wow. Yeah.
Yeah.
That makes sense. I think, yeah, you're describing it well. Like I can picture what you're saying.
Yeah, essentially this gets really short when you have condylar resorption.
Yeah.
And then you can imagine you do a massive advancement on a patient like that, but there's still no this.
Yeah, absolutely.
That vertical component of the mandible. So he just creates that. Whereas you're right, though, a lot of people just implant that in without actually extending the condyle with a total joint replacement. But dude, it's so overwhelming to think about all of that.
Yeah, it's so much stuff. But I think what I'm hearing from you is that if you're going to consider getting jaw implants, take a look at your jaw joint health, your TMJ first.
Or if you're doing any kind of jaw surgery,
think,
you have to. And it's a major blind spot in the space because most surgeons don't do joint replacement. And as we know, doctors will just ignore things that they're unable to treat because first of all, they have a natural blind spot for it because there's nothing they can do about it. So what's the point of bringing it up? You're just going to end up going elsewhere to actually get it treated. Right. So if joint replacement is not a tool in your arsenal, you'll tend to just dismiss joint problems because there's nothing you can do about it. But the risk is that pre-existing joint problems plus jaw surgery, which adds more stress to the joint, often leads to really catastrophic relapse in a revision jaw surgery. So he does a tremendous amount of jaw surgery revision with joint replacement. For that exact reason.
I see. Yeah. I feel like that's another one of those cases or examples where for some people the minimally invasive approach or the less invasive approach is not correct. You've done the jaw surgery, you didn't take the step forward. Now there needs to be this correction, which incurs even more risk than had you just started with, a more appropriate solution. Yeah, I hear that.
And then you take that philosophy to its extreme, and now you go from tooth-borne expander to double jaw surgery with total joint replacement.
Yeah. That's like the gateway drug.
But Dr. Movahed has had 3 jaw surgeries, and it was only his final one that had the total joint replacement. So that's why he does this, because he's been through it.
Holy shit! Do you know if he had any adverse side effects from doing the surgery that many times?
Dude, I asked him. I was like, how the fuck did you do this 3 times?
Yeah.
And I forget exactly what he said, but my feeling about what he said was basically that he's like, when I want something, I want it, and whatever. He's a tough son of a gun.
Sounds like it.
I mean, this is a guy who's slamming jaws and joints for a living, so that's a different type of animal.
He can feel it and he can take it,
Yeah. He's definitely getting high on his own supply. Yeah. Well, that's awesome, man. I want to be respectful of your time. I really appreciate having had the opportunity to speak to you. And I look forward to you coming back into the media space where you can join the jaw hacking discussion. It's growing. There's more and more people that are becoming interested all the time. And I think voices like yours that are rooted in experience, someone who's been through it, would be good to have you back on YouTube.
Oh, thanks for saying that. And super grateful for the opportunity to come on. It was so much fun. I feel like you and I could just kind of rant till the cows come home. It's run in all different sorts of directions. So thanks again, really.
Hell yeah. Thanks a lot, Evan. We'll talk soon.
Cool. All right. Take it easy, Ron.
All right. Bye-bye.
Bye.